Deficiency of B vitamin in the diet causes angular stomatitis, beriberi, peripheral neuropathy. False answer PM, osteoporosis. In Bangladesh, prevalence of anemia in various age groups are true answer less than 30%, under 5 children, about 46% pregnant women, more than 50% lactating mother. False answer more than 60% under 2 year of children, more than 60% adolescent boys are anemic. Deficiency of B vitamin in the diet causes true answer angular stomatitis, beriberi, or peripheral neuropathy. False answer PM, osteoporosis. In Bangladesh, prevalence of anemia in various age groups are true answer less than 30% under 5 children, about 46% pregnant women, more than 50% lactating mother. False answer more than 60% under 2 year of children, more than 60% adolescent boys are anemic. মানে হচ্ছে 30% হচ্ছে আন্ডার 5 চিলড্রেন থাকবে, 46% প্রেগনেন্ট ওমেন থাকবে, 50% ল্যাকটেটিং মাদার থাকবে। নর্মাল বিএমআই ইন অ্যাডাল্টস ইন এশিয়া আর টু আনসার 18.5 আর 20, বাকিগুলো হচ্ছে 16, 17 আর 30। Components of integrated management of childhood illness IMDR, true answer improve case management skill of health staff. Improve case management skill of health staff, true answer improve the health system, improve family and community practice. False answer improve referral system, remove cultural barrier. Total live birth is the denominator of. True answer infant mortality rate, neonatal mortality rate, maternal mortality rate. False answer crude death rate cause a specific death rate. Measures of fertility are true answer total fertility rate, child woman ratio. False answer case fatality rate, child dependency ratio, stillbirth rate. The data set 1 to 3 has mean 2, median 2, range 2. False answer mode 3, SD 2. Indicators used in the measures of fertility: birth rate, general fertility rate, general marital fertility rate, age specific fertility rate, age specific marital fertility rate, total fertility rate, total marital fertility rate, gross reproduction rate, net reproduction rate, child woman ratio, pregnancy rate, abortion ratio, marriage rate. Measures of dispersions, true answer range SD, false answer mean, median, mode. A plus b whole square equals to true answer a square plus 2ab plus b square a minus b whole square plus 4ab. False answer a square plus 2ab minus b square a plus b whole square minus 4ab a square minus 2ab plus b square. The major sources of air pollution in the city are true answer industry, transportation, refuse disposal, power plant. False answer hospital. The common direct cause of maternal mortality are true answer anemia, hemorrhage, unsafe abortion. False answer malnutrition, congenital heart disease. Benefits of exclusive breastfeeding are true answer child grows well, child suffers less infectious disease. False answer child needs no vaccination, mother needs no extra dietary energy, prevent conception up to 1 year. Cause of childhood diarrhea include true answer rotavirus, enterotoxigenic E. coli. False answer streptococcus, haemophilus, campylobacter. The following are the measures of morbidity. True answer prevalence rate, incidence rate. False answer growth rate, attack rate, good birth rate. The major sources of air pollution in the city are true answer for herd immunity to exist, following condition must be met. True answer transmission must be direct from one member of host species to another. Reservoir in which the organism can exist outside the human host. False answer that disease agent must be restricted to a single host species. Reinfections induce parietal partial immunity. Infections induce partial immunity. Population approaches a non-random mixing. For herd immunity to exist, following condition must be met. True answer transmission must be direct from one member of host species to another. Reservoir in which the organism can exist outside the human host. False answer the disease agent must be restricted to a single host species. Infections induce partial immunity. Population approaches a non-random mixing. Screening is done for diseases with the following features. True answer disease which can be diagnosed after screening, disease which known with known natural history, disease with known natural history, disease which have treatment available. False answer, disease with a low prevalence in population, disease for which case fatality rates are low. Following diseases are not caused by virus. True answer, rheumatic fever, enteric fever. False answer, poliomyelitis, smallpox, common cold. Graphs used for qualitative data. True answer, bar diagram, pie diagram, multiple bar diagram. False answer, histogram, line diagram. Qualitative variables include true answer, sex, emotion. False answer, body weight, hospital patient number, age. Acute upper respiratory tract infections include true answer, acute epiglottitis, otitis media, pharyngitis, laryngitis, common cold. Sentinel surveillance indicates true answer, identifying high risk groups. Some selected hospitals for surveillance in selected areas to report the cases of disease. Sentinel surveillance indicates identifying the high risk groups. Some selected hospitals for surveillance in selected areas to report the cases of disease. False answer, identifying the missing cases. Surveillance of water pollution, surveillance of surveillance of environmental control. Discrete variables are true answer, number of beds in hospital, number of patients in hospital, number of admissions in a hospital. False answer, weight, height. Demographic processes are true answer, fertility, mortality, migration, social change. False answer, fecundity. Characteristics of healthcare include true answer, adequacy, relevance, comprehensiveness, accessibility. False answer, validity. Characteristics of ideal healthcare: appropriateness, comprehensiveness, adequacy, availability, accessibility, affordability, feasibility. Channels of communication are true answer, group media, conventional media, mass media, interpersonal media, modern media. Components of motivation are true answer, behavior. False answer, physical well-being, learning, education, adoption. Stages of motivation: initiation, direction, a sustained behavior. Primary health care is based on the following principles to answer, equitable distribution of health services, community participation at all levels. False answer, provision of essential drugs, be as close to the beneficiaries as possible, psychological rehabilitation. Components of physical quality of life index, infant mortality rate, literacy. False answer, limitation of activity, limitation of mobility, expectation of life at birth. Components such as infant mortality, life expectancy at age 1, literacy. Comprehensive healthcare means to answer, curative, preventive, promotive. False answer, interdependent behavior, people cooperative to satisfy their basic need. Elements of essential service package, ESP are to answer, child health care, reproductive health care, behavioral change, communication. False answer, integrated support service, sector-wide management program. ESP also reproductive health care, child health care, communicable disease control, limited curative care, behavior change, communication. Changing concept of in public health are the true answer, disease control phase, health promotional phase, social engineering phase. False answer, primary health care phase, human resource development phase. Disease control phase, health promotional phase, social engineering phase, health for all phase. Changing concept of health, true answer, biomedical concept, ecological concept, holistic concept. False answer, well-being concept, environmental concept. Health related MDG are true answer, eradicate extreme poverty and hunger, reduce child mortality, improve maternal health. False answer, achieve universal primary education, promote gender equality. Cohort study yields true answer, incidence rate, relative risk. False answer, prevalence rate, odds ratio, attributable risk. Levels of health care are true answer, primary, secondary, tertiary. False answer, elementary, comprehensive. Elimination refers to true answer, decrease incidence of disease, reducing financial burden to the community, interruption of transmission of disease, presence of the infectious agents in the environment. False answer, reducing complication of disease. Postcoital contraception include true answer, intrauterine contraceptive device, hormonal methods, post-conceptional methods, progesterone only pill. False answer, vaginal ring. Active immunity of an individual develops true answer, as a result of infection by a specific vaccination. Immunity is specific for a particular disease. False answer, by administering antibody containing preparation by vertical transmission across the placenta. Preventable vaccines prevent the following diseases. True answer, hepatitis, diphtheria. False answer, tuberculosis, poliomyelitis, hepatitis A virus infection. Primary health care networks are mainly focused on preventive care, provides comprehensive care, needs no huge investment. False are available only in hospital setup, involves only doctors and nurses. Indications of health services are to answer doctor patient ratio, doctor nurse ratio, bed population ratio, false answer child mother ratio, communicable disease no non communicable disease ratio, communicable disease non communicable disease ratio. The nosocomial infections are true answer infection acquired in hospital, cross infection in hospital, false answer iatrogenic infection, certain types of nasal infection resulting in nasal discharge. Appropriate to financing of healthcare includes to answer balance between needs, resource and uses. Balance between needs, resources and use. Appropriate selection of target, false answer productivity, occasional process of improvement, limited partnership. Human Development Index includes to answer GDP per capita, adult literacy rate, false answer life expectancy at age 1, infant mortality rate, maternal mortality rate. Anthrax is regarded as a to answer exotic disease, episodic disease, enzootic disease, wool sorters disease, false answer holoendemic disease. Nutrition is a science. To answer food in short, food and metabolism, food and growth, food and its relationship to health, false answer malnutrition. Carbohydrate does not contain to answer nitrogen, phosphate, false answer carbon, hydrogen, oxygen, CHO. High biological value of proteins are derived from to answer egg protein, milk protein, false answer pulse, vegetables, cereals. Deficiency of vitamin A leads to answer xerophthalmia, keratopalacia, false answer anemia, goiter, kwashiorkor. Morbidity indicators are true answer incidence and prevalence rate, duration of stay in hospital, notification rate, false answer crude death rate per capita GNP. WHO recommended approaches for the primary prevention of chronic diseases are true answer. Answer false, high risk strategy, early diagnosis and treatment, primordial prevention, population mass strategy, disability limitation. WHO recommended approaches for the primary prevention of chronic diseases are among the epidemiological studies to answer case control study is called retrospective study, relative risk is calculated from a cohort study, descriptive study generates hypothesis, false answer from cohort study we got odds ratio. Prospective study, prospective cohort study starts with a group of disease and a group of no disease. Prospective cohort study starts with a group of disease and a group of no disease. Chronic non-communicable diseases to answer do not have a biological agent but have risk factors, are caused by non-reversible pathological alteration, have multifactorial causation and long latent period. False answer expected to require a short period of supervision, observation and care, may be cured completely with appropriate treatment and care. Factors influencing high fertility rate in Bangladesh are to answer age at marriage, social stigma, breastfeeding, education parity. Measures of central tendency are to answer mean mode, false answer dispersion variance range. Measures of central tendency are to answer mean mode, false answer dispersion variance range. Growth chart is used for to answer growth monitoring, identifying high risk children, planning and policy making, false answer complementary feeding, identification of children. Meaning of communication to answer exchange of views and ideas, to talk over phone for giving and taking information. On false answer only talk each other to discuss the matter only, do not get feedback. Groundwater contaminants are significant in Bangladesh are to answer arsenic, false answer molybdenum, manganese, potassium fluoride. Greenhouse gases do not include to answer carbon dioxide, methane, ozone, false answer carbon monoxide, hydrogen. Greenhouse gases carbon dioxide, methane, chlorofluorocarbon, nitrous oxide, N2O, some other gases. The following are the organic dust borne diseases to answer bagasosis, tobaccosis, false answer asbestosis, silicosis, siderosis. Cause of neonatal mortality are to answer prematurity, birth injuries, false answer preeclampsia and eclampsia, birth asphyxia, advanced maternal age. The sources of motives are to answer biogenic or sociogenic, economic, religious, false answer contrast, innate. Disease transmitted by fomites are to answer typhoid fever, measles, bacillary dysentery, false answer hepatitis A, cancer. Arsenicosis is to answer non-communicable disease, false answer infectious disease, waterborne disease, autoimmune disease, contagious disease. The following greenhouse gases are contributing to global warming to answer carbon dioxide, methane, chlorofluorocarbon, false answer nitrogen, halogen. The disease which are transmitted by mosquito are true answer dengue, filaria, false answer kalajor, anthrax, bird flu. Bacteriological indicators of water contamination are true answer Cl tetani, S. typhi, false answer Cl perfringens, fecal streptococcus, E. coli. Smoking can be associated with the following: true answer carcinoma, larynx, lung cancer, esophageal cancer, false answer colon cancer, liver cancer. Conditions affecting learning are motivation, age, mental health, false answer habit, gender. Epidemic prone diseases, true answer diabetes, hypertension, cholera, false answer kidney disease, yellow fever. Indications of anti-rabies treatment are true answer unprovoked bite. The biting animal can be traced or identified. The fluorescent rabies antibody test of the brain of the biting animals are positive for rabies. If the animal does not show any signs of rabies within 10 days of observation, nobody bites by wild animal. The following are the test criteria for screening test: true answer repeatability and validity, false answer non-simplicity, costly, easy of administration, rapidity. And the following are the functions of management: planning, organizing, false answer appreciating, influencing, inspiring. Criteria of screening test: applicability, repeatability, validity, sensitivity, specificity. ভার under এগুলা examples of primary prevention are true answer measles, immunization, smoking cessation after heart attack, fluoridation of water supply, false answer cervical cytology screening, breast self examination. AIDS is due to true answer reduction number of helper T cell, reduction of CD4 cell, false answer reduction of number of reduction in number of killer T cell, autoimmunity, non production of interferon. Human cell infected by HIV, CD4, helper T cell, monocyte, macrophage, B, lymphocyte, astrocyte, oligodendrocyte. Sanitary latrines are to answer bore hole latrine, septic trunk, water seal latrine, false answer shallow trench latrine, deep trench latrine. Health is considered as to answer perfect functioning of the body, multidimensional, central to the concept of quality of life. False answer not an integral part of development, one that can be measured directly. Components of epidemiology are as follows: disease frequency, distribution determinant, false answer health promotion, environmental sanitation. Endemic means when a disease, true answer, occurs clearly in excess of normal expectancy, is habitually present in human population, affects a large number of countries simultaneously, usual occurrence of a disease. The true answer occurs is habitually present in human population, usual occurrence of a disease. False answer occurs clearly in excess of normal expectancy, affects a large number of countries simultaneously, exhibits a seasonal pattern. And objectives of surveillance are true answer epidemic prediction, estimation of future disease impact, disease burden estimation, false answer epidemic detection, periodic health examination. Objectives of surveillance are true answer epidemic prediction, estimation of future disease impact, disease burden examination, disease burden estimation, false answer epidemic detection, periodic health examination.